Another question I think a lot of people would like to know is, you know, we would like you to also shed some light on cancer patient going through chemotherapy or radiation, drinking Kangen water, because when they have the big C, they are very careful about what they put into their body. And also there are doctors who tell their patients that alkalized water or antioxidant is bad for them. It will interfere with the results of the intended chemotherapy, etc. So what's your take on that?
The fact of the matter is that the chemotherapists, that the oncologists, people treating cancer victims with chemo and whatever, is to make a point that you shouldn't do antioxidants because it'll interfere with the chemo. And I've done the research and I've done the papers and I've looked at all this, and it's total bunk. It's not true. It is simply not true that antioxidants interfere with chemotherapeutic treatment. Now, in some cases, like ovarian cancer, it's actually helpful to take antioxidants. But the benefit of Kangen water in relationship to chemotherapy is a little more subtle than that. People get sick from chemotherapy. They vomit, they have nausea, they feel lousy, and what have you. Hydrating oneself significantly before getting the chemo helps tremendously in reducing the side effects. And there are a number of very, very, very prominent clinics in the US right now that actually encourage people to drink the Kangen water because it reduces the nausea, it reduces the vomiting, and the hydration. When you vomit, you get dehydrated, and when you get dehydrated, you vomit more. So you need to reverse that vicious cycle, and the water is excellent. Does it cure cancer? No, I wish it would, but it doesn't. But it certainly ameliorates symptoms and makes them better.
Another question. I'm not sure if I can pronounce her name right, Yogis. The question is, for chemotherapy and radiotherapy patients, can they continuously keep hydrating with pH 9.5 while undergoing treatment to boost their cell hydration as well as getting the kidneys to excrete out the chemo medications faster?
The answer is unequivocally yes. Unequivocally yes. They can absolutely do that. Now, let me sneak in another little observation. I used to see a lot of women in my clinic, my wound care clinic, who were undergoing radiation therapy for breast cancer. And radiation is like sunshine. These redheaded, pale white women really get affected badly by that radiation. Their skin, melanin protects your skin from radiation, ionizing radiation and regular radiation. The minute I take an 11.5 water, soak a towel in it, put it on the chest wall that's been burned, in 5 minutes they feel better.
Oh.
It's like treating a burn, and that 11.5 water is excellent. It absolutely helps dramatically. And so what I do is I give them a gallon jug and I send them home, and they come back every 3 days and get a refill, and it helps. Now, that makes total sense to me because it absorbs those radicals that have burnt the skin and soothes it. I mean, treating a burn with cold water dates back, what, a million years probably?
Fantastic.